but it's been lots of other people around the country, and I know many of them personally.
And so what have you done to instead?
For right now, what I've done is I became an employed physician and work in an urgent care, just to guarantee a salary, but that obviously was not what I trained to do, and it's not my first choice. I would still love to get back to seeing patients and then providing good medical care. But at the way current things are currently, there's just no way to do it.
And how does the urgent care business differ from the primary care business? Why is the model still working in urgent care?
I think the urgent care, well, one, there's a higher, just to be seen in the door is a higher copay. That's number one, and it's more of a convenience. A lot of folks, they're good since they're open usually later than the primary care office, and they're also open on the weekends. And it's more, you walk in, and depending on how busy you are, you might be there 15 minutes, you could be there a little bit longer, but it's more of the convenience, and I think usually the urgent cares are owned by maybe a hospital, or like a Rex or a Wake Med or something along those lines, and so you have those dollars behind you also. But they tend to do better than the standalone practice, and most of also they don't deal with the chronic diseases as you would in your, and the chronic diseases, quite frankly, spending half hour with a diabetic, hypertensive person with cholesterol issues, you can probably get reimbursed the same as spending 5 minutes with someone with a sore throat or a cough.
Right.
And so I know that folks can understand that, but it's just the way the insurance and the billing is done, and so it's much more profitable and easier to see 20 sore throats than it is to see 20 chronic medical problems and diabetes included.
Sure, sure. And when you were in business for yourself, talk about the experience. I'm interested to learn more about the experience of working with both private insurance companies and Medicare, and how the reimbursement rates differ.
Right. Medicare currently is paying physicians at the 2001 reimbursement rates. So when you have a plumber come to your house, he obviously doesn't charge you 2001 rates. That doesn't exist.
Right.
And then the insurance companies pay you, depending on your contract, a percentage of it. So small group, like when I first got into practice, there's 4 of us. Blue Cross is paying us 110% of Medicare. Well, with Medicare, you're actually losing money when you see those patients. You might as well hand them a $20 bill on the way out.
Wow.
So when we had our office manager look at our practice, is 50% Medicare, 50% Blue Cross. In this area, Blue Cross is the 800-pound gorilla.
Right.
When she looked at the cost of doing business, how much it cost us per patient, when you pay everybody's salaries and benefits, we were actually losing money with Medicare and Blue Cross.
Wow.
And so, but we couldn't, in good conscience, get rid of Blue Cross and Medicare and get rid of, a bunch of your practice. So the only way that smaller groups are surviving is you have to get involved with larger groups. And if you have a big, powerful group behind you, then where there's strength in numbers, then your insurance contract rates are better. So you might get 130% of Medicare or something along those lines. So it's a constant fight, a constant struggle. Contracts change every year. What I think has definitely affected patients has been, well, there's many things. One is every year their premiums go up. They're usually they get a high deductible plan.
Right.
And in my personal experience, a lot of my employees, even though I was paying 80% of their premiums for healthcare, chose not to elect to pay that 20% because they couldn't afford it.
Wow.
So they prefer to go without it. And nationally, the statistics show there's actually 12 million people who actually could get employer-sponsored health insurance, but they elect not to.
Because of the copay.
Yeah, because of the premiums are too high. They just can't afford it. And the insurance is sometimes just a big game, because they try to deny prior pre-existing conditions, prior loss of coverage. They find any way, quite frankly, not to cover that patient. And so when I was in private practice, I would see a patient, and the patient, I think the majority just quite frankly don't understand insurance, and they weren't trying to pull a fast one. They didn't realize that they were not being covered for their pre-existing condition, let's say diabetes, with the new insurance, and they didn't know it. And diabetics usually come every 3 months, and they'd run up this huge bill, and then they didn't know they weren't getting paid, so they didn't pay me, and the insurance didn't pay me. And that's just what would happen. And I think, quite frankly, they just had no clue that they were not going to be covered up to 3 years.
Wow.
For that condition. That's usually the only reason they were coming to see me was because of their diabetes. So it's tough, and the insurance companies have quite frankly have said they're not going to lower their premiums. To have more people insured, they need to answer to their shareholders and their
right.
And they need to, and I know their CEOs are actually, on average, usually making $25 million a year, and that's like 3 times what your typical Wall Street CEO would be making. So what I see is a lot of the money going to the shareholders and CEOs, and basically not to the doctors, and basically just denying a lot of coverage for the people paying into the system.
It really does seem that the insurance industry is such a big part of the problem, in the sense that a lot of people, when you ask them, well, what is insurance? You can actually have a discussion where people come to the conclusion, and I've come to the conclusion, that healthcare insurance that we call insurance, it's not really insurance at all. In the sense that you don't buy car insurance and expect it to pay for oil changes. You don't buy homeowners insurance and expect it, just because I've got homeowners insurance doesn't mean we can have a campfire right here on the porch and expect to get a new house for $15 if we burn the place down. That's negligent.
Right.
But that's kind of how we expect health insurance to work, and the whole idea that insurance is really pooling risk for unexpected or catastrophic things, that's not what healthcare insurance is. It's more like pay a bunch of money, and if you need care, we'll fight over how much we'll pay whoever you go to see if we pay anything at all.
That's exactly what it is. And to some of the developed nations, what they've done is the insurance companies, like Switzerland and Sweden, are not for profit, and they truly pool the risk and everything else. And no one has Medicare or Medicaid. What those governments do is they subsidize the private insurers, and so patients are getting covered that way. Because we spend probably billions of dollars, and I don't remember the numbers, on administrative costs.
Right.
For Medicare, Medicaid, and even administrative costs for insurance companies. So I think that's where a lot of the dollars just being sucked up into.
Mm-hmm.
But it is an excellent analogy. When I take my car to get fixed, I don't expect the auto insurance to pay for it.
Right. And it does seem like there's a difference between chronic care and ambulatory and preventive care, and where you're trying to maintain your health, versus acute episodes where you have to go to the hospital or you have to engage the services of a specialist. And I guess this is getting to another question I have. Did you ever have people in your practice who would come up to you and say, Doc, we've got a healthcare savings account and I just want to pay cash? And is that part of the market dynamic that you saw at all yet? Or
no, there were folks with health savings account, but that was a minor part of it. So no, I can't say that was big. That's still very, very small. Very small part of what people are doing. Most folks, quite frankly, thought because they had that insurance card, that means they were licensed to do whatever, get whatever, and couldn't understand why they were being denied X, Y, or Z services by the insurance company. And
sure.
And they're the ones practicing medicine for you. There's times when I felt the person needed this medicine or needed this imaging studies procedure, and they would just say no. And there's nothing I could do.
And then you're spending time on the phone trying to
fight with them and appeal. And the studies all do show that preventative care does save money in the long run. And I think the problem is, from what I've heard other insurance companies say, is the reason they don't invest money up front in preventative care is because they're not going to see the reward in the back end. Because people change insurances so often now. It's not like every year your employer seems to be changing insurance, trying to get the cheapest rates, and so they feel like, well, that insured person is not going to stay with us for 20 years. So by the time they get their bypass, it's going to be on somebody else's insurance.
Mm-hmm.
And where is if they did spend the money on the preventive service, and if the system flipped more to whether 70% primary care physicians and less specialists, then I think the system as a whole could save money, and the nation would be better taken care, as opposed to that episodic care that you're describing.
Sure. There's an intriguing book that I've been reading. It's basically, and I almost didn't read the book because the title was so over the top. And the title is basically The American Healthcare Crisis Solved. And it's written by these two gentlemen who have a long background in the healthcare industry, and specifically healthcare insurance for individuals, as well as healthcare savings accounts. And from my perspective as a consumer, it seems like, and a patient and a father with kids and all that good stuff, it seems like the idea of healthcare savings accounts really does make a lot of sense, to do everything we can to get as much money into the hands of individual patients, with the idea that right now we've got massive subsidies that are occurring every year that allow employers to write off the entire cost of their employer-provided healthcare benefits